Myalgia parasitica, it's very common, yet very rarely diagnosed or addressed. Basically, it's the lateral cutaneous femoral nerve. The lateral femoral cutaneous nerve is a very small nerve, and it's located, and it's only sensory, and it gives sensation only to the anterior lateral portion of the thigh. But because we have big people, it can get crushed very easily. It's right, it comes along the ilioinguinal ligament area, so a big abdomen, when they're sitting, can compress that nerve easily. Men wearing their belts below the belt line, tight belts, can compress that nerve very easily. Pregnant patients can get it. If you have a patient with a big abdominal tumor, can get it. It's an annoying sensation that they will feel in the anterolateral portion of their thigh, which is right here. It's a very small nerve. It has no function but sensory just to the anterolateral of the thigh. It's present most of the time with a lot of those kind of type of patients, but it's very rarely addressed and very rarely anything done about it. And it can be done. A small little block, and you can do a radio frequency. You can get rid of that pain pretty easily without any problem. It doesn't take a lot to do. Again, we went over these. The obesity, you see this in seat belts, tight trousers, pregnancies, any kind of big masses in the abdomen. This is a picture of the ganglion implant block approach, which is done under fluoro. Basically, it's at the tip of the coccyx. And this needle, they show it as straight, but it's technically you need to bend it approximately like into a U shape. So you feel and you touch the tip of the coccyx, and then you invert the needle, and the needle curves up. It's almost like a U-turn, and goes up at the side to catch the ganglion. And you do this on the fluoro. You give a contrast, and you're catching the sympathetic chain basically for address rectal, pelvic, lower abdominal area pains. Again, this, of course, the biggest risk is not only infection, but also bleeding. You have to make sure all their platelets, PT, PTT, INRs are all within normal. The other thing is if they have a big rectal cancer, that the cancer is not sitting right in your way. So that's another thing. But this can be done. It's pretty easy. I modified this entry myself. I enter at another point to catch the ganglion myself, which is a little easier than doing this kind of approach. The other things, which is not as interventional, but yes, just as helpful, is a TENS unit. TENS unit has been used during pregnancy, delivery. It is it's almost like call it as a portable massage unit. You put on the pads. They have 4 pads, 2 on each side. You can turn it on. It gives a release. And the way they think that the theory behind it helps is through the gate control theory, and they think that also it helps release some endomorphins, so it helps with some pain. Some of the indications that they have used the TENS unit for, they have used it in postherpetic neuralgias, facial pains, including the spinal cord injuries, rheumatoid arthritic pains, back pains. In fact, they have used it in obstetrics during delivery. Of course, we go through lots of disorders that can help. It can be used. It's basically very simple. It's a very simple unit. In fact, most insurances do cover the TENS. The only way they cover the TENS is mostly for a indication of low back pain. they won't cover it if you're trying to use it for everything else that is used and it's beneficial for. However, you go on Amazon.com, there are millions of these units out there, and you can find them for $50 or less. It's a very simple thing. They have little square pads for two in each side with electrodes attached to a little box like this. You place them where you're feeling the pain in the lower back region or abdominal. It could be into the knee. You've used it for therapy to strengthen the quad muscles with knee area. You place them on, you turn on the electrodes, and you feel vibrations and massage-like sensations. Personally, I've used it myself for a big spasm in my neck region, and it really makes a difference. It takes a while, but it's not everybody is not appropriate. The skin has to be intact. They don't have to have any infections. You know, there is many things that you have to look for. Plus, some people's skin, they can't have any pads attached. They have poor attachment. Either whether it's their skin is oily or they sweat a lot, and so the pads don't stick well. So adherence of those pads are important too.